Care facility in Vancouver, now the latest location of a COVID-19 outbreak in Southwest Washington.
We found out 7 deaths, along with more than 25 residents and staff testing positive at the Highgate Senior Living facility in Vancouver. Let's switch right to our Lisa Balick, who is getting answers for us tonight. She's in Vancouver with what she found out.
I found out that lack of equipment may be in part to blame.
The first case was a staff member, and so that staff member was isolated.
That was April 5th, but the virus had already started to spread. Another staff member tested positive April 8th, but it wasn't until April 13th when everyone here was finally tested for the virus. I asked, why more than a week-long wait?
There is no protocol for universal testing. We decided, we decided that we wanted to test everybody in the facility. I don't believe there's a protocol to do that, and we were fortunate to have a partner who had the testing supplies and was eager to help us out. And that's why that's how we identified, all these other cases in the facility, including people who are asymptomatic.
18 out of 58 residents tested positive, along with 8 staff members. The outbreak was in the memory care unit, not the assisted living unit, which are in separate areas. Melnick says Highgate notified residents, staff, and their families as soon as the first case was identified. I asked if investigators found anything that could have possibly spread the virus.
There were issues with enough gowns.
When I asked what that meant, Dr. Melnick said there was some reusing of gowns, an inadequate supply, but it's been solved. I contacted the Highgate company, which runs almost a dozen facilities in 4 states. They told me, quote, as you know, there's been a national shortage of PPE available to our healthcare and especially our industry. Highgate has been diligent in our efforts to obtain the appropriate equipment for our team members during this time. We appreciate the partnership with Clark County Department of Health and Washington State Social and Health Services with this procurement. Melnick believes, though, more training is needed.
Assisted living facilities and adult family homes are more like home settings. They're not staffed the same way that skilled nursing facilities are staffed.
Highgate says it continues to keep family members up to date about their loved ones at the facility. In Vancouver, Lisa Balick, KOIN 6 News.